the lung diseases are also increasing in non-smokers.
Non-smokers also can get lung cancers. It is quite high. You can say around 40% of the lung cancers are there in the non-smokers.
If a cold or a cough is extending for more than 3 weeks, is it a red flag?
Underestimate that chest pain, which can be a lung, which can be related to vascular system, it can be related to cardiac system.
So what are the treatment options available for interstitial lung disease?
Having a good diet is very important. So nutrition also plays a role to play in interstitial lung disease.
With the increasing pollution and the air index of Mumbai air quality getting worsening day by day, how is it affecting the pediatric age?
The reason is that pollution, when the high suspended particulate material is high, that gets settled, heavy gases get settled down.
There's one concept about inhalers as a treatment.
So inhalers are safe, they are very effective.
Pollution damage the lung.
It's just not the lung disease, it's a systemic disease. That's why pollution should be controlled, that if you don't control our pollution, they affect small kids also.
Hello and welcome to the official podcast series of Lilavati Hospital and Research Center. Breathing is one of the most vital functions of human body, yet it is ignored until it becomes difficult. With the rising rates of asthma, COPD, lung infections, chronic lung diseases, it is imperative for us to understand about lung health. So today, we are joined by Dr. Pralhad Prabhudesai, one of India's leading chest physician and pulmonary specialist. With over 35 years of experience in chest medicine, medical education, bronchoscopy, and pulmonary rehabilitation, he has dedicated his career in helping patients to breathe better and live fuller life. In today's conversation, we will understand the science behind the lung to debunk the myths from the facts and get practical advices on how to improve our respiratory health. So Dr. Prabhudesai, welcome to the podcast and thank you for joining us.
Thank you very much.
With the increasing number of lung diseases, smoking is often associated that it is major causes of lung disorders. But nowadays, the lung diseases are also increasing in non-smokers. So what is the reason behind that?
Biggest problem in increasing diseases in non-smoker is one is air pollution. Second, both indoor as well as outdoor air pollution. Third important thing is the rising infections. And fourth is there are a lot of inflammatory disorders which happen in the lung, which are also causes of morbidity and of course mortality. So it's not just smoking. Remember that smokers will have diseases, but passive smokers, third-hand smokers, and so many other factors are also responsible of chronic respiratory disorders.
So definitely smoking is not the only culprit
Correct.
in causing lung disorders. So since you mentioned about pollution, can pollution damage the lung even in a proper healthy individual?
Yes, not only lungs. Of course, you know that lung is the first organ to enter, okay, as well as the pollution is concerned. But there are various types of pollutants inside. Suspended particle materials are there of various sizes. They can affect from nose to the alveoli, and from the alveoli, that is the last part of the alveoli, from where the oxygen and carbon dioxide going inside and coming out happens, that is gas exchange, what we call. Pollutant particles of smaller size can also exchange from the lung into the arterial and venous system. And that can give rise to a spread to various other organs which are never thought that pollution can affect. Most important thing, cardiovascular and system, vascular system and cardiac system. It also can affect intestine, it also can affect genitourinary system, it can also affect liver and various other organs. So pollution is just not the lung disease, it's a systemic disease. That's why pollution should be controlled, and I will say that the future will be that if you don't control our pollution, they affect small kids also and elderly also. And if the children get affected, the development of the organs get affected. So the lungs, the other vascular system, other cardiac system, other organ systems, they are actually growing in the children. So that growth gets affected and you get diseases at a very early stage. And also that affects the overall quality life and most important survival quantity life also. So pollution is the most important culprit according to me, and we have to face that in the near future.
So doctor, definitely this was an insightful information for our audience. With the increasing pollution and the air index of Mumbai air quality getting worsening day by day, how is it affecting the pediatric age?
Yeah, just now I said that pediatric age group is most affected. Okay, we are not aware of that. The reason is that pollution, when the high suspended particulate material is high, that gets settled, heavy gases get settled down. And our children at that height are more inhaling all these toxic compared to the adults who are little taller, and this heavy material, or dust particle, they are more in down. So that's why children will get more affected.
So, doctor, what are the most effective ways for us to protect our body from the pollution?
Well, I think we have to have more awareness about that. Smoking cessation will prevent indoor pollution. We already achieved a good amount of success in controlling smoking in the public areas. Okay. Similarly, the indoor pollution also should be reduced. That's one. And of course, the construction sites which are happening in Mumbai, we are facing a very different level of pollution because of the construction which is happening at all over the places. Okay, that also can be controlled by proper taking care of covering, etc., and all that on the wherever the demolition of the building happens. And of course, planting trees is a very good method of controlling the pollution to some extent. Okay, so we can control pollution by, if we are decided, automobiles. So overall, automobiles, if you can reduce, good amount of electric vehicles can reduce pollution to great extent. Similarly, traffic jams can be reduced. Okay, so because in the traffic jams, the car consumes more petrol and produces more pollution. So this is all things to good roads, electrification of the cars. Then the cars should be well checked properly for PUCs and all. And bridges, long bridges can reduce the pollution. Planting trees on this thing. And for a short distance, avoid vehicles. Cycles can be, it will create health also, and it reduce pollution also, especially in the smaller areas. For example, in the university campus, instead of scooters, they should use cycles, and cycles should be promoted. Electric cycles are also there. Though people cannot bicycle, then they can have electric cycles. I think once you have decided to do anything, that pollution has to be reduced, it is possible. It's not impossible.
Doctor, definitely these are some practical habits one audience can adapt in reducing and preventing themselves from lung disorders. One of the most common symptoms of lung disorder is cough. So how one can differentiate between a common cough symptom and versus a very serious lung condition?
So cold and cough, which is the hallmark of simple common cold. There we have running nose, sneezing, short period of fever, and that lasts for 3 to 5 days. Okay, this is a common cold, and we don't have to treat with antibiotics. We don't have to treat these patients seriously. But whenever there is a very high grade fever, 101, 102 degree temperature with severe body pain and headache, so this condition, this is not a common cold which is associated with cough, throat pain. This must be influenza. So that's very important thing. If the patient has got a sputum which is there for a prolonged period of time, which is mucopurulent, that is yellowish or greenish, indicates bacterial infection associated with fever. So this is how the simple method we can understand whether it's a viral, whether it's a bacterial, and how much duration is happening. That gives idea regarding the seriousness of the illness also. So people who are healthy, they require supportive treatment for the cold and cough. Antibiotics are not required generally because they are viral. Especially in the pediatric age group, we should avoid antibiotic. Even in adults, unless patient has got some chronic lung diseases associated and they are having immunosuppressants or they are on steroids or some other, or transplant patient, etc., only those patients may require a good amount of active care with antibiotics after consulting to their primary physician. Routine antibiotic use should be avoided. Buying antibiotic from chemist shop should be avoided. That's very important message you can say. And as most of these cold cough are viral pollution.
Doctor, this gives us quite great distinction points between a common cold cough and a lung disorder. But if a cold or a cough is extending for more than 3 weeks, is it a red flag?
Yes. If the patient has got a first time cough extending for more than 2 weeks, I will say, one should rule out tuberculosis in the Indian scenario. And I feel in this patient, sputum should be examined for tuberculosis, okay, which is freely available in government setup. All the government state do free charge. There is no charge for sputum examination. Even gene expert study, which is so expensive outside, but government does it free. We should do it.
So definitely a persistence of any symptom is a warning.
And also we should take an X-ray chest whenever it's warranted, whenever it's required, because we can get a diagnosis of pneumonia, we can get a diagnosis of other conditions which are like TB can be a sputum negative also. So addition of X-ray chest will give us a important differentiation from TB and other, and this is very important.
Followed by cough, breathlessness is associated with considered as aging. But is it always associated with aging, or can there be an underlying lung disease also?
Yeah, breathlessness is a very huge term. There are many causes of breathlessness. It is not necessarily be only aging. Young people also can have breathlessness. Okay, young adults, young females, elderly people also can have, and even the extremely serious old patient also can have breathlessness or day-to-day activity. So we have to remember that breathlessness can happen because of many reasons. Simple reason is anemia. If hemoglobin is low, person will feel breathless. Second, if patient has got underlying lung disease, which may be airway disease like asthma, bronchitis, he will be breathless. If he has lung fibrosis, he will be breathless. Okay. If he has got acute event, like suppose there is some clot embolism, pneumothorax, pleural effusion happening, water accumulating, he will be breathless. So this is acute breathlessness. And also patient can breathless on walking prolonged period of time can happen because of he is being deconditioned, fatigue. Okay, and that's why the breathlessness can happen. Besides this, cardiac causes are there. Angina, okay, cardiac valvular heart disease will give breathlessness, and of course, obesity itself can give breathlessness. Then there is something called breathlessness due to stress, anxiety. Okay, that's also not uncommon. Okay, and that feeling of breathlessness is also related to the mind, because finally the mind also is important part to give us symptoms of breathlessness to a patient. So all these are various reasons for breathlessness. Okay, lung, heart, and other diseases, even chronic kidney disease can give breathlessness. So breathlessness is just a symptom, and one has to investigate thoroughly to find out the exact cause of breathlessness. There is a condition called sleep apnea syndrome. Okay, the serious sleep apneic patient many times are breathless because they are fatigued, they're tired. Okay, so that feeling of tiredness and fatigueness is expressed by the patient as a breathlessness. Commonest condition like hypertension. If the BP is uncontrolled, patient may feel breathless. Remember, so these are some of the common symptoms, common diseases which are associated with breathlessness. So breathlessness needs a very good history taking and a clinical examination, some basic tests, and of course, then if you are not really getting a diagnosis, then this patient should be referred to specialist.
So, except coughing and breathlessness, what are the top warning signs for lung disorders when a patient should consider visiting a physician, and how they decide should they visit a general physician or a chest specialist?
So, acute chest pain, okay, is also an important sign, and one should not underestimate that chest pain, which can be a lung, which can be related to vascular system, it can be related to cardiac system. Okay, so chest pain can occur because of that. Okay, the serious diseases. Then sometimes the running nose, sneezing, constantly sneezing is related to the allergic rhinitis, which is also part of the respiratory system. Okay. Third important thing is excessive sleepiness, tiredness, fatigueness, snoring. These are also respiratory disorders, sleep-related conditions like snoring, tiredness, not feeling fresh in the morning, excessive daytime sleepiness, while driving, feeling sleepy. These are also serious complaints, because if you miss this diseases, sleep apnea like disease in the drivers, and you can have these are the social issues. Patient can have a problem, and patient can create a problem to others also. So these are all important symptoms which one should think about.
Doctor, since we are on the topic of coughing and breathlessness, there's one concept about inhalers as a treatment, and many people avoid using it. Why is the reason behind it?
First of all, inhalers make a sound. Tablet doesn't give a sound. Tablet, if you take, people don't know you are taking tablet or not. But inhaler, because of sound, somebody listens and he's taking inhaler. If you are taking 2-3 puffs like that, then they will say, "Arey, kitna baar puff le rahe hain?" Okay. So of course that becomes straight away people know around you what you are taking. That's number one. And second important thing is that there is a concept in the people's mind that inhalers means you are serious. That's why they would like to avoid inhalers in any form. And second thing, they prefer to take syrups, tablets. But this concept is actually absolutely incorrect. I explained to my patient, this is like applying an ointment. Suppose you have injury over here in the hand, whether you will take tablet, injections, or you apply ointment. So of course ointment, because you can apply at that area itself. So my medicine will not go anywhere else. Okay. Similarly, inhaler, the medicine goes to that area itself where the problem is. Okay, so it can go to the nose if I take the nasal inhalers. It will go to the chest airways if I get the inhaler either directly or through a spacer. Correct technique is very important. So inhalers is like an applying ointment. It can be taken on the long-term basis also. It can be taken a short-term. They are not addicting. It's most important if they are addiction. This is addiction. This is not. It's a good addiction. If asthma patient takes regular inhalers, it's a good addiction. So I don't think this is addiction, and you should take inhalers. Whatever the medicines is available in the local form, local in the sense locally applicable form, they are always superior because they create lesser amount of side effects. So inhalers are safe. They are very effective. I can give an example. If you take a tablet, you take a 40 parts of the tablet. The 40th part, whatever the dose is there, is in the inhaler form. And the tablet will go to the abdomen, will get absorbed, and it will go everywhere in the body. This is not. So it gets locally acting. If your technique is correct, then that 40th part of the medicine is very effective.
So, doctor, one message for our audience will be to avoid taking their medical treatment decisions on their prejudiced conceptions. Correct. And more on science-backed evidence. Moving on to interstitial lung disease. What exactly is interstitial lung disease and why it is usually late diagnosed?
This is now people are aware the interstitial lung disease, interstitial lung abnormalities, the terminology, diffuse lung diseases, okay, fibrosis, the common word, okay, and they put the word fibrosis in the Google, they read it and they get shock of their life, okay, and they run away here and there to find out what exactly has happened. Interstitial lung disease is not a new disease; they are old. Now awareness is increased because we have a better way to diagnose them, and we have to make a better way to manage them and monitor them. So interstitium is a part of the lung where alveoli, that is air sacs, meet the capillaries, blood capillaries. Blood comes from all over the body to the right side of the heart, pushes that blood to the lung, and when the pushes the blood, it goes through small capillaries from the main pulmonary artery, divides, and small capillaries, through that they go to the alveolar sacs, and these alveolar sacs, the air comes from the nose to the trachea and bronchial tree to the alveolar sac. So the area between the alveolar wall, which contains type 1 alveolar cells, basement membrane, interstitium, that the area between the capillary and the lung, that is generally there is some collagen tissue, very mild form, minimal, and there are capillaries. The capillaries has got endothelium, there's the blood flowing, and there is RBC. So passage of oxygen from the alveolar to the RBC is that area is called arterial membrane, or what we call gas exchange membrane. Okay, so that membrane is the interstitium. So any disease of that area can give interstitial lung disease. Now, where this interstitial lung disease can happen? It can happen because of some injuries happening through the lung or injury happening through the blood circulation. Lung brings most of the blood over there, okay? All over the blood of the body comes to the lung, to the capillaries. And air which we breathe also goes over there. So that's why this area is very vulnerable from infection to inflammation. And that's disease for interstitial lung disease.
Thank you, doctor, for explaining such a complex sounding disease with such simplicity. As mentioned, it is usually diagnosed very late. Is there any similar symptoms between interstitial lung disease and other disorders?
Yes. So as I told you, that interstitium is like this. So you can get injured acutely or you can get injured slowly. So when acutely it injures, like for example, last time we had gotten pneumonia, H1N1 pneumonia were there, and COVID pneumonia. These are all pneumonia involving interstitium and these areas. Okay, or suppose you inhale some toxic gas, it can also injure acutely. Okay, so or some medicines given, like chemotherapy is given, acute injury can happen. Okay, to the alveoli. So it can be acute, which are generally not missed because symptoms are fulminant, serious, and that can be diagnosed immediately. But the chronic interstitial diseases, chronic pneumonias, okay, chronic interstitial lung disease, like due to pollutions, due to the pigeon's dust, okay, or pigeon producing a lot of antigens which inhale, or bird producing antigen, or a fungus which is there in the surrounding area in the house because of leakages, or if you have fungus which is there in the farmers surrounding. So there are many causes that patient can get. Slowly those diseases can happen. Similarly, a patient has got arthritis, various types of rheumatoid arthritis or scleroderma arthritis or other arthritis form, vasculitis form. So these diseases from the vessel, they will also injure the interstitium, but it may take longer time to get injury. And then that's why the patients takes a long time to get diagnosis, because the symptoms are cough, breathlessness, and these two complaints are common complaints for everything. Asthma also will have same complaints. COPD also will have same complaint. TB also will have same complaints. Okay, or some pneumonias also will have same complaints which are happening for a long period of time. Okay, so of course the symptoms are the same. That's why we don't think about this rare condition. We try to think about common diseases like TB, like asthma, COPD. So most of the time, these interstitial lung disease patients are treated for asthma, sometime for COPD, sometime for tuberculosis, sometime for chronic pneumonia, okay, or sometime for some sort of reflux disorders, okay, which are also going to give chronic cough. So diagnosis is always late because you need a special test for these diseases. X-ray will not diagnose interstitial lung disease. You need a high resolution CT scan, okay, that is expensive. You need a complete pulmonary function test and most important, you need a good doctor to auscultate the patient's chest, which gives a sound called crackles, Velcro crackle. You must have opened the Velcro, the sound comes. The same crackle sounds you hear, and the physicians can just putting a stethoscope on that can suspect that this patient is likely to have ILD and not asthma.
Thank you, doctor, for explaining that. It was really insightful information. So what are the treatment options available for interstitial lung disease?
Treatment depends upon the cause. So we try to find out the cause of interstitial lung disease. If it is an acute interstitial lung disease due to the pigeons and hypersensitive pneumonia, if it is due to the collagen vascular disorders, the treatment for the primary disease is very important. For hypersensitive pneumonia, you have to take the patient away from those antigens. So you have to remove all the causes, all the antigens which are there surrounding. Antigens means particles to which patient is allergic or sensitive. This allergy is different from asthma allergy, remember. Okay, so it is not asthma, but there is an allergic element inside which is different type of allergy, and that's why it's called hypersensitive pneumonia. You take the patient away from that area to somewhere else, your antigen exposure reduces and patient becomes all right. He can completely get cured also in early stage. So removing the antigen is most important. Treating the primary disease, like for example rheumatoid arthritis treatment, then scleroderma treatment, the treatment for Sjogren's disease and other myositis related disorders, which is a systemic disease. So this systemic disease produces a lot of systemic products, and they are circulated to the blood vessel, go to the lung, because all the blood finally comes to the lung, and there is inflammatory response happens. So when you treat this disease get controlled. But stage happens when the fibrosis starts happening. Inflammation now converted to the fibrosis, that is the end stage of inflammation. Now there we have got very limited medicines to work. Okay, so we have to prevent fibrosis, and if you want to treat fibrosis, we need anti-fibrotic medicines for that, and hence the treatment is anti-inflammatory and anti-fibrotic, either inflammatory alone and later on anti-fibrotic, or anti-fibrotic, purely anti-fibrotic, and inflammatory medicine happens whenever there is an acute problem. So combination of inflammatory and anti-fibrotic at the correct time is very important for treating these patients. So some of this interstitial lung disease affects the windpipe, and sometimes giving inhalers in few diseases can also be useful. Okay, like for example, a smoker can have an interstitial lung disease. He can have chronic bronchitis and emphysema also. So his lungs are also affected, his airways also affected. So in this condition, you have to give inhaler therapy also and anti-fibrotic therapy also. And also, of course, he has to stop smoking completely. So this is how we treat the patient of ILD. Along with that, yes, in advanced ILD, we give them oxygen therapy whenever required. All these patients should be subjected for pulmonary rehabilitation. Don't underestimate pulmonary rehabilitation. If you put the patient in rehab, outcome is better. Okay, so we have to look at the patient as a holistic way rather than just as a disease. Okay, So this holistic way, what I mean is that exercises, diet, rehabilitation, counseling them, giving them meditation and yoga, okay, preventing their new infection by giving vaccines, okay, like flu vaccine, pneumonia vaccine, and whatever the vaccines which are the guidelines says, we should give this patient vaccination. And remember, all these things have to be maintained. It is not one time, okay. Vaccination should be done regularly, not one time vaccination. Flu vaccination every year, okay. Pulmonary rehabilitation is not just for the one time. It has to be maintained. That's called maintenance program, okay. Meditation should be done regularly because there are internal illnesses. So mind also has got a role to play in all chronic diseases. Remember, major role. People not know that half the complaints are mind related, and you go to a doctor, and then of course doctor will try to treat you the disease, and if he doesn't give importance to mind, you are wrongly treated. Next most important, I'm telling you, why general understanding this is important, because abdomen is very close to the lung. So if any abdominal discomfort, improper food, not giving proper digestion, more gas formation, constipation, that will bloating, that will affect the lung, and they have more symptoms. You will not feel good. Okay, so you go to a doctor. Doctor will give you antibiotic, step up your steroid. So this is how we forget. So having a good diet is very important. So nutrition also plays a role to play in interstitial lung disease, because there is something called gut microbiome. You must be knowing that. So our good happy hormones which brain secretes are actually not secreted by the brain, but they are secreted by the gut. So all these serotonin and other GABA, all these hormones which give you good well-being, sense of well-being, also they affect your autonomic system. So these affect by the gut microbiome. So if you have proper diet, giving good gut microbiome will help you to produce anti-inflammatory medicines which can migrate from gut to the lung, gut to the brain, and that's called gut and lung interaction, or gut and the lung interaction. So this is how the diet also plays a role to play in these diseases.
So definitely this helps us underscore the importance of understanding the cause before jumping into the treatments, and how important lifestyle choices are in helping our lung health. Since doctor, you mentioned about pulmonary rehabilitation. What exactly is pulmonary rehabilitation and how it is improving a patient's quality of life?
Pulmonary rehabilitation is the word itself, rehabilitation, means a negative thing, okay, but it is not. It's the most positive thing, okay. You rehabilitate womb, say there is a drought is there, you rehabilitate. If the earthquake is there, you do rehabilitation of this patient. So we have some sort of a negativity there, okay, there is something has happened. Pulmonary rehabilitation is actually the word rehabilitation. If you remove, everything is positive there. All are charged. Patients are charged, motivated. Patients' relatives are motivated. Doctor is motivated to give you rehab. The physiotherapists which are motivated, and they motivate patient to stick to the good healthy lifestyle, where they are given idea regarding the nutrition, their assessment is done properly, what exactly their goals are in life. They want to walk, they want to climb, they want to pick up their grandchildren, and they want to do their day-to-day activities, they want to go to job. All these goals in their life we try to achieve by assessment, giving them good exercise program, counseling them, also giving them nutritional important to them, and we reassess after exercise program how much they have achieved the goal, and if they achieved the goal, we keep them maintaining that goal. So it is much different than physiotherapy. Physiotherapy is just to remove the secretion, do some breathing exercises. Here this is more bigger concept. It's an individualized concept. It is not everything. Same thing is not applicable for you, for him, and for me. It will be different for that patient itself, and it is done 3 times in a week or maybe more than that. It may be done supervised, may be done unsupervised if it's far. You may be doing home rehabilitation. It can be done in the hospital rehabilitation. It can be done in a clinic. It can be hybrid. It can be on tele-rehabilitation. But finally, the movement should happen in the patient. That will give him a good amount of quality life. His breathlessness will go down. His muscle strength will improve. And you will see a positive energy in the patient. He can cope up with all the activities. Most important thing is that these patients require a lesser amount of hospitalization. Their ICU stays are lesser. They don't go to visit the doctor in emergency basis. So their elective visits are there. They have got a good amount of response to the therapy, whatever we give, the bronchodilator, etc. and all that. So quality life is better of these patients. So this is all benefit, and this is level A, level B evidence-based. So it is not like that. It can be done to all respiratory patients: COPD, asthma, ILD, bronchiectasis, sarcoidosis, cancer patients, patient before going major operation, patient after major operation. If patient wants to do a lung transplant, without rehab, they will not take for lung transplant. Before lung transplant, after lung transplant, patient recovering from very serious infection from ICU, it takes time to come to a normal stand. This time they need a rehabilitation. So where everything is done under supervision, you may have to give oxygen during rehabilitation. You may have to support the patient with CPAP or BiPAP at home when they are doing rehabilitation for a better this thing. Patient is promoted vaccination program. They are given lecture, education about their disease. Okay, they are also being told about or given importance to their all other social activities. They are socialized. So we conduct in rehabilitation, get together, some sort of programs for them for their emotional activity. So emotional well-being, spiritual well-being is also included in the rehab program. So that's why rehabilitation, if patient stick to the rehab, he will get a great benefit. And unless you go there, you will not understand that. Okay, the patient who go there, when they come out, are much different than patient is not doing rehab.
Doctor, it is reassuring and enriching to know that treatments nowadays is not just about medications, but can also be through pulmonary rehab and becomes a part of improving the outcome of their symptoms. So, Doctor, we'll be moving to a segment where we help our audience debunk the myths from the facts associated with lung diseases and disorders. Starting with, can non-smokers get lung cancer?
Yes, non-smokers also can get lung cancers, and it is quite high. You can say around 40% of the lung cancers are there in the non-smokers.
Does vaping damage the lungs?
Yes, it damages the lung. It can give us to serious lung inflammatory conditions because of vaping, and it is underestimated actually.
Is steam inhalation beneficial for lung health?
Steam inhalation is not for the lung, it is for the upper respiratory tract. Steam is water, so when you inhale steam, it finally gets converted to water, and warm water or hot water can mucolyze the secretion which are there in sinuses and upper respiratory tract, and it get hydrated, the secretion become thin out, and then you can drain them out by doing Shuddhi Kriya, by yoga, and by other techniques for removing secretions.
Are air purifiers really helpful for patients with respiratory problems?
Chronic diseases who are restricting themselves to home and they were seriously ill, okay, they are not moving here and there, they can be remaining in the air-conditioned room with the air purifier, will help.
Thank you, Doctor, for debunking the myths from the facts. One last message you would like to give the audience regarding the respiratory health?
Well, respiratory health is not just respiratory related, but remember, sleep medicine also come into a respiratory. Okay, so I think you have to see that the sleep, nutrition, exercise are three important aspects for good health. So we do underestimate sleep. So sleep also is a very important part, and we should try to see that our person sleeps for at least 6 to 8 hours. Now remember everything, we talk about 6 to 8 hours. You will ask me, are you sleeping for 8 hours? Okay, so of course I'm not sleeping for 8 hours, but I'm giving my importance to my sleep. I don't go for late night partying and all. Okay, so sleep is important. Okay, how will you know that you have slept well or not? When you get up in the morning, if you feel fresh, and if you don't feel sleepy during the daytime, even you have that 5 to 6 hours of sleep, you are slept well. So quality of the sleep is very important. If your disturbed sleep is there, how will you know that your sleep is disturbed? Okay, you are frequently awakening from the sleep, or because of your snoring, your partner is telling you to sleep. You are trying to tell you that you snore very loudly, you get choked sometime. Even patient feels he is sleeping, his sleep is disturbed, or fragmented sleep. Okay, or it can be arousal, micro arousals, and then this sleep quality will not be good. This patient will be sleepy daytime, he will not be fresh, he will have cognitive dysfunction, memory, then focusing to your work, okay, calculations, okay, negativity will be there in this patient. So all those things which are there for cognitive dysfunction will be happening in these patients who are sleep apneic. They disturb your other diseases, hypertension, ischemic heart disease, cardiovascular diseases, brain disorders, Parkinsonism, chronic kidney diseases. Every disease has got some component of healing which happens inside, that happens in sleep. If a sleep is disturbed, the functioning, you can say that servicing of these organs get affected. And then you will have problems. Despite of proper medication, patient will not be all right. So sleep, understanding sleep, gives you window to treat these patients. Very important, because 1/3 of your life in sleep.
Thank you, Dr. Prabhudesai, for clearing the air quite literally. Today, the message we take with us is that the lung health is not only about what we inhale, but also about our habits, choices, and awareness we cultivate. Thank you again for joining us, sir.
Thank you very much for nice questions.
And to our audience, thank you for listening. And until next episode, invest in your health, invest in your future, and take decisions consistently, consciously, and one breath at a time.